Hi, I'm Ted Kruse with Physical Therapy Solutions, and today we're going to talk about shoulder impingement. Shoulder impingement is a general term that we will use and a physician will use to describe shoulder pain. And once you come into physical therapy, it's part of our assessment to figure out the true cause of that impingement. Impingement is an appropriate name for what you're dealing with shoulder pain. The most typical symptom is shoulder pain lateral or on the outside of the shoulder, kind of down the side of the arm. Some people even get it all the way down to the elbow at times. And what we're talking about with shoulder impingement is that pinch. So if we take a look at the anatomy of your shoulder, this would be your collarbone, the front of your scapula, and the arm bone going down, so the head of the humerus up here. What we're really looking at is this space right here called the subacromial space, and that's the space between the acromion, the tip of the shoulder, and the ball of the shoulder underneath it. And in that subacromial space is an area that a lot of structures, soft tissue structures, have to live and function. We're talking about rotator cuff musculature, specifically the supraspinatus, and that muscle is responsible for raising your arm up. There's also a bursa in there, a subacromial bursa, that can become inflamed and become irritated or impinged as well. We treat most of these structures the same. We do try to kind of differentiate which one would be bothering you, but treatment-wise is going to be pretty similar. So when we look at the musculature here, you can kind of see that subacromial space gets filled up pretty quickly with the rotator cuff musculature and tendon under here. What happens with impingement is as we raise our arm up, the most common symptom is at about 90 degrees or shoulder height, we start to feel a sharp pain right on the outside of the shoulder. And that's because the bursa, rotator cuff, or that soft tissue, is pinching between the head of the humerus and that edge of the acromion. Some people anatomically are more prone to have this. They can have what's called a hooked acromion, where that acromion kind of edges down into that subacromial space a little bit. Those people would be more prone to, over time, develop a rotator cuff tear. What we do is try to structurally open up that space as much as we can. The best way that we find to do that is posture. Many people are very forward with their shoulders, rounded, and that closes down that subacromial space. So to put it simply, as you raise that arm up, that space closes down faster and you'll get that impingement much earlier. Over time, as you continue to do that, it can wear on the rotator cuff. It makes that bursa more and more inflamed. The symptoms become worse and worse. It's not uncommon for us to see somebody that's unable to lift their arm at all from their side if this is really significant and inflamed. We can differentiate between rotator cuff tear because this movement will improve if there's simple impingement. If there is a significant rotator cuff tear, we may not be able to get their motion to improve, and they would have to go on for further assessment, probably with an orthopedic physician. If you have shoulder pain or have more questions on what shoulder impingement syndrome entails, feel free to contact us at our Dyersville or our Manchester location. You can also look us up on our website, www.ptsiowa.com, and check us out on Facebook. Thank you.